So breast lifting. Tell me a little bit, what are the frequently asked questions women have about breast lifting?
Well, most women complain about the fact that they've just lost that volume, that oomph of the breast that they had before they had children. Now, as we age, obviously, we all lose some of that elasticity and tone, and particularly women lose that in their breasts. What most women are scared of in that surgery is they all say, well, I don't want the scars. I hate the way that the scars look. Maybe I won't scar well. And again, the issue with plastic surgery, the magic of plastic surgery is not doing things without scars, but placing the scars in inconspicuous locations so that nobody notices them, and that we can achieve the surgical goals without incurring those unsightly scars. Now, what I like to do with a breast lift is rearrange the tissues of the breast without losing any of the volume. Okay, we don't remove breast tissue. We only remove a little bit of that skin at the bottom that's excessive now because the breasts have stretched out. They've lost their elasticity and their tone. Okay. So we like to rearrange the tissues, place the nipple back where it belongs, back in the center of the mound, so it creates a nice, perky, and youthful look to the breast. Okay, so in our consultation, I always ask women, well, what are you unhappy about with your breasts? And I want to be very particular about it. Are you unhappy about the shape of your breast or the size of your breast? Or are you unhappy with both? Because we could do something to correct any one of those conditions. So if you're unhappy only about the shape of the breast, you just don't like the way that it's drooping now. It used to be very good, but now it's just lost that kind of, that position on the chest. So we can lift the breast, again, take away only the excess skin at the bottom, and that's all that you need. If you're unhappy about the size of your breast, obviously we could place an implant there and do a breast augmentation. If you're unhappy with both the size and the shape, well, we can combine breast implant, which is the augmentation part, and the lift to create, again, a fuller and more youthful looking breast.
What about reductions?
Oh, reductions are some of my favorite surgeries, and they're very complicated to actually do. And it's one of those surgeries that you get better at every one that you do, and you can do you could do thousands over a lifetime and still be learning with each particular case. Breast reductions, what we do essentially is reduce the size of the breast. We take away breast tissue, and we also take away the skin at the bottom that's corresponding to the excess tissue. And with every reduction that we do, we also do a lift. So you don't only get to improve the back pain and the shoulder pain, that bra strap grooving that women with large breasts get, but all of a sudden, now that the breasts are smaller, perkier, they're lifted up, I find a lot of my women like to walk around without a bra, and they're just kind of...
And where do you hide the incisions?
Well, we hide them, the incision that we use is either a lollipop incision, which means around the areola, and a vertical incision, or we could add an incision at the bottom, at the fold that separates the breast and the abdomen, and make it into an anchor pattern, the classic Wise pattern. Now that's a variable length of a scar depending on how much needs to be done. We always try to minimize the scar burden to the patient so as to get the best and most natural looking result with the least amount of scarring that's possible.